Just finish it up and we can move on to the next one. Let's see, we have a left knee. Let's see, downloading. It says it's for osteomyelitis or osteomyelitis. It's bone infection. It's a left-sided bone infection, supposedly on the knee. Oh yes, this is something else. This really can't be good. Yeah, it's a major case of osteomyelitis for sure. Let me just do an MPR. Of course, they did no contrast enhancement. Oh, they did. They did a contrast enhancement phase, but I don't know. They did a very small quantity of contrast, almost none, which helps us very little. So, but I'm still going to do an NPR and see if it can helps us find out the margins, the limits of the fluid collection. So there are a bunch of fluid collections all over the bones, all around the body of the shaft of the femur. And let's see, we just fix this positioning. Yes, see, clear signs of bone erosion. Yes, multiple small sequestered fragments. There is air, cortical erosions all over the place, and we also have some sort of fluid collection on the soft tissue parts. It goes all the way to the growth plate, the diaphysis, and the metaphysis of this particular femur. So this is a epiphysis is also eroded. So this is a very severe case of bone infection, as said, as it says, as they say on this exam request. Yes, you can see the margins of the fluid collections on soft tissue parts. This helps, so I can properly measure them. And I'm going to measure as much as I can the site of osteolysis right there. So I'm just going to write that down. Bone is 5.5 by 3.4. And let's see on the sagittal view, maybe on the axial view, it's best. Anterior posterior might be best. Yes, anterior posterior 1.9, so 1.9. And here we can properly delineate. Oh, of course, they didn't scan it all the way, so it's another guesswork challenge, of course. Why would they scan it all the way if they can just scan like crap? And they did it twice. They scanned it twice the wrong way. There is a large articular effusion, and there is a periosteal collection that looks a lot like the bone erosion. So it's supposed to be pretty much the same. So just going to give them an estimate of the collection. It goes all the way to here, but soft tissues, it's for 4.7 by 4.3 by 1.5. That's it. And let's just see if we can find any other disease. No, just the articular effusion, the edema of soft tissue parts. There is a site, probably a site of fistulization right there. It is right there. A small skin ulcer. Maybe this is a surgical incision, and there is drainage of the collection of fluid through the soft tissue all the way to the surgical scar. I suppose it is. This is a really terrible case of bone infection for sure. So let's describe it really quickly so we can move on to the next one.